Hey there, welcome to my YouTube channel, or welcome back. I'm Pharmacytechlove. I've created a series of videos designed to help you become a certified pharmacy technician. Throughout these paid courses, you'll learn everything from pharmacy math and drug names, including both brand and generics, to SIC codes, pharmacy laws, and the ins and outs of both retail and the hospital setting. I know many of you have shared concerns about not getting the right material in the classroom. That's exactly why these videos are here, to supplement your existing coursework. My content isn't meant to replace your live or online classes, but rather to be an extra resource. Maybe call this your little cheat sheet to success. While these videos are tailored for pharmacy technicians, they're also perfect for anyone in healthcare, meaning future pharmacists, doctors, nurses, phlebotomists, and more. And a quick tip, please be sure to take notes while you watch. Pause the video whenever you need to jot down key points so you don't miss anything. Let's dive in. Welcome to your pharmacy training. In this video, we'll explore the vital role you play in supporting pharmacists, ensuring safe patient care, and keeping the pharmacy running smoothly. Pharmacy technicians are the backbones of pharmacy operations. Your mission? Support licensed pharmacists in preparing and dispensing medications, managing daily workflow, and delivering excellent service to patients. Your specific duties may vary depending on your work setting, which some of your work settings could be retail, hospital, long-term care, or mail order, and state regulations. But in every role, accuracy, professionalism, and attention to detail are essential. Let's break down the core responsibilities of a pharmacy technician. So, number one, medication preparation and dispensing. This is where you will be counting, pouring, labeling, and packaging medications. You will measure and mix ingredients for compounding. If you're trained and authorized, now remember, you can get a lot of certifications on PTCB and NPTA, which I think the website has changed, but they will guide you where you need to go. So all you have to do is Google PTCB or NPTA. Now, you do have to be a certified pharmacy technician in order to take these courses. All right, let's move on. Prescription processing. This is where you will receive and process prescriptions or medication orders from patients and healthcare providers. You will enter patient and prescription data into the pharmacy computer system, and you will also verify all information for accuracy and completeness before filling. Let's move forward to inventory management. This is where you will order, stock, and rotate your medications. It is so important to rotate your medications because we don't want the new orders or the new medications that are coming in to be put in front. We need that to be rotated in the back. So that way the older medications are pulled to the front, the ones that are maybe possibly going to expire, of course, sooner. So just think about it like this. Say, for instance, you have milk at home and you go buy a new jug of milk. Are you going to put that new jug of milk in front of the old one? Of course not, because the old one expires first. That's the same concept that I want you to think about when you're in the pharmacy. Okay, moving forward. Next, you will check the expired products and dispose of them properly. You will also manage controlled substances in compliance with the DEA regulations. Let's definitely discuss customer service. So customer service entails answering phone calls and assist patients with non-clinical questions. So whenever I say non-clinical, it's going to be something that the pharmacist has to complete. It may be a question, a patient may call in and ask, what can I take for a migraine? That will be considered a clinical question, and that's also counseling. So that is definitely going to be a question for the pharmacist. You will also, this also falls in line of customer service. You will process insurance claims and resolve any rejections. You will process claims in your pharmacy, throughout the entire day. Okay. All right. Last, with customer service, you will help patients understand their medications, but always under the direct supervision of a pharmacist. I just want to talk to you about something really quick. As a pharmacy technician, unfortunately, with your friends and your family, you will no longer be who you originally were before you became certified. Now you are looked at as the drug dealer. The closest friends and the closest family that you thought you had will now possibly ask you to steal medication for them. Have I been asked this before? Definitely, dozens of times. Am I going to go to jail and risk my life and my reputation and my certification for anyone? Absolutely not. So when that situation comes to you, I want you to prepare yourself and tell them no. You let them know, I have a reputation, I have a life, I have children, I have bills, I have things that I am trying to accomplish. Why would I do that? Okay? And I need you to stand firm on that. Let's also discuss administrative tasks. You will maintain patient profiles, prescription records. You will be handling billing. You will also work at the cash register. Depending on if you have a drive-through, you will work in your drive-through pharmacy. You will also work at the point of sale transactions in the retail setting. Basically, that just means you'll be working the cash register. You will also support quality assurance and compliance efforts. Just always make sure that you're following your company's policy. That is the most important thing. Pharmacy technicians work in a variety of settings. So let's discuss those three settings. So first we have the retail pharmacies, which focus on customer service, prescription filling, and over-the-counter guidance. Next, we have hospitals, which prepare sterile compounds like IVs, IV as in Victor, IV, which means intravenous, and also deliver medications to units. You will do a lot of walking in the hospital setting. You will walk at least 5 to 6 miles per day, so you will definitely get your steps in. And last, in the hospital setting, you will collaborate closely with nurses. I understand because I've worked in the hospital setting for 7 years, and I know how stressful it can be communicating with the nurses. For some reason, we're like hyenas and lions. I'm not sure why. But for you, as a pharmacy technician, I want you to take that stress away from talking to your nurses. And what I want you to do is put in that place is that all of this is for the patient. Don't worry about bickering with someone because this is not about the nurse. This is not about you as the pharmacy technician. This is about our patient. Next, we have long-term care or mail order. This is handling bulk packaging, medication cards, and process high prescription volumes. I have worked in a pharmacy where we were preparing 700 to 800 prescriptions a day. That was a large volume pharmacy. Let's also discuss scope of practice. While technicians are essential to pharmacy operations, there are more important limits to our scope of practice. First, we do not counsel patients. We do not provide clinical advice. We also do not make final decisions about medication therapy. These responsibilities belong exclusively to a licensed pharmacist. Last but definitely not least, as a pharmacy technician, you are a trusted partner in patient care. Your accuracy, organization, and customer service skills keep the pharmacy safe, efficient, and welcoming. Remember, when you excel, the patients thrive. I want to talk to you briefly. You will be entrusted with a lot of patients' information. You may know these individuals, okay, throughout your community. Those patients are depending on your professionalism and also HIPAA, Health Insurance Portability and Accountability Act, to keep their information safe. Remember, you are the front line of the pharmacy. Welcome back to the quiz portion. Number 1 reads, which of the following is a core responsibility of a pharmacy technician? Counseling patients on medication side effects, recommending a change in a patient's therapy, counting, pouring, and labeling medications, or diagnosing a patient's symptoms. The answer is C. Pharmacy technicians prepare and dispense medications, but counseling and diagnosing and therapy changes are the pharmacist's duties. Which task would you most likely perform in a hospital setting? Answering OTC product questions for walk-in customers, preparing IV solutions under sterile conditions, advising a patient to switch medications, or prescribing antibiotics? The answer is B. Hospital technicians often prepare sterile IV solutions. OTC, which represents over-the-counter, customer service, is most common in retail. What does inventory management include? Making final medication therapy decisions, rotating stock and checking for expired medications, counseling patients on drug interactions, writing new prescriptions for patients. The answer is B. Inventory management involves ordering, stocking, rotating, and disposing of expired meds, not clinical decision making. Okay, let's continue on. Who is legally allowed to counsel patients on how to take their medications? Pharmacy technicians, nurses, pharmacists, or medical assistants? The answer is C. By law, only licensed pharmacists can provide official medication counseling. Which setting is most focused on bulk packaging and high volume processing? Retail, hospital, mail order, community clinic? The answer is C. Mail order and long-term care pharmacies handle large volumes and often package medications in bulk. If a prescription order is missing the prescriber's signature, what should you do? Sign it yourself? Fill it as written? Notify the pharmacist immediately? Call the patient for approval? The answer is C. Missing signatures makes prescriptions invalid. The pharmacist must address it with the prescriber. Which of the following is not a responsibility of a pharmacy technician? Processing insurance claims, entering prescription data into the computer, providing clinical drug therapy recommendations, counting and labeling medications? The answer is C. Clinical recommendations fall under pharmacist duties, not technicians' responsibilities. What is the role of a technician in controlled substance management? Prescribing them when needed, helping track, store, and document according to DEA regulations, deciding when patients can receive them early, giving dosage adjustments. The answer is B. Technicians assist with DEA compliant handling but cannot make prescribing or dosing decisions. Also, DEA means Drug Enforcement Agency. They handle narcotics. In retail pharmacy, which task is common for pharmacy technicians? Preparing IV chemotherapy, resolving insurance claim rejections, managing hospital floor stock, performing patient diagnosis. The answer is B. Insurance processing is common in retail. IV chemotherapy is hospital-based. Okay, we are on our last problem, which is problem number 10. What is one of the most important qualities of a pharmacy technician to have? Ability to diagnose illnesses, strong attention to detail, authority to prescribe medications, ability to change a patient's therapy. The answer is B. Accuracy and attention to detail are crucial for patient safety and pharmacy efficiency. Hey, Pharmacy Tech Love here. I wanted to just come show my gratitude and thank you for supporting my channel. I really appreciate it. And please share my content if you can help someone else that's ready to grow and learn. I would really love that. You guys have a wonderful evening. I'll see you in the next video.